Now, as the fluid passes along the nephron, the next part that it comes to is the proximal convoluted tubule. And if you were going to say in one word what the proximal convoluted tubule is about, you would probably say reabsorption. Because the PCT reabsorbs a large proportion of most things back into the blood. There are capillaries surrounding it, and that takes these substances away. Now, as a rule of thumb, it's around 2/3 of many of the substances which are reabsorbed. So somewhere around 67% of the water, of the sodium, of the chloride, of the potassium, and numbers vary a little bit for different substances, but around 2/3 of most things are going to be reabsorbed. The reabsorption here is isosmotic, which means that water is following the salt reabsorption and the concentration within the tubular fluid doesn't change. It's more or less the concentration of plasma, which is approximately 300 milliosmoles per litre. So that's what we would find in the Bowman's capsule, and by the end of the proximal tubule, although there's much less fluid left, because so much of it has been reabsorbed, the concentration is still around 300 milliosmoles per litre. So we haven't started doing any of the urinary concentration, which the kidney is so good at this stage. You might question why you would bother to filter so much fluid over the course of the day and then reabsorb most of it straight back into the blood, almost immediately it's been filtered. It seems a strange thing to do, and of course you can't achieve reabsorption without expending energy, so it's also a costly thing to do. So why do it? Well, the answer to this is probably an evolutionary answer, and we can think back to our caveman days. You can imagine you're a caveman wandering around and you see some tasty looking berries on a bush and you think, well, I'd like to eat those berries. But no human has ever eaten these berries before, and when you eat them you suddenly find that you've got a lot of toxins in your body that the body has never been exposed to before and really wouldn't know how to deal with. Now, if you had a kidney that worked purely by secretion, you might think that that was a more efficient way to deal with what kidneys need to do. Such a kidney would have to have transporters for the chemicals that it didn't want, and it would actively pump out those chemicals into the urine, and you would eliminate only the substance that you wanted, and you wouldn't do all of this filtration reabsorption business. Well, that's absolutely fine if you know exactly what it is in your blood that you don't want. But if you've just eaten a bunch of berries and you've got some toxins in, you might never have encountered those before. You might not have a transporter to get rid of that toxin, in which case you're a bit stuck. But using the system that our kidney works by, ultrafiltration followed by reabsorption, what you're reabsorbing are the substances that you know you do want. All of the toxins from those berries, you don't know that you want them, you don't have any transporter to reabsorb them, and that means that they get left behind. So they remain in the tubular fluid even when the other substances have been reabsorbed, and ultimately they're going to be lost in the urine. So the system may seem inefficient, but it actually works very well in getting rid of a large range of small molecules that you might not have encountered before, and you might not have specific transport systems to deal with. A lot of those toxins are going to be lost. Now, nowadays, it's going to perhaps be more relevant to consider drugs. Because, of course, if you put drugs into a patient, the patient doesn't have a transporter system for that drug because it's some new kind of chemical. It will still be eliminated by the kidney, assuming that it's small enough to be filtered. And so that drug will eventually be eliminated from the system, and that's why it's important to consider drug regimes and the dosage that you would require in order to keep the appropriate dose within the body over a given time. So the kidney is very good at eliminating unknown compounds. The cost of that is that it has to reabsorb a lot of the stuff that it does want back from the proximal convoluted tubule.